Hi everyone, my name is Stephanie Spicer and I'm a Lymey. I'd like to talk today about why Lyme recovery can take a long time. Just to make it clear, I'm talking here about chronic Lyme disease, not acute Lyme. If you just contracted Lyme and you're in the acute stage, you should seek antibiotic treatment immediately if you want to avoid having the problem we'll be discussing today. Just to clarify, as I always do, I'm not a doctor or a medical professional of any kind, so what I say here shouldn't be taken as medical advice. I'm just one Lymey sharing with another what my experience has been. You've probably heard it said before, Lyme recovery is a marathon, not a sprint. Why is this? Why can't we just do a few weeks or months of treatment and be done with it? The short answer is that Lyme bacteria are just really hard to kill. I mean, it's hard to kill all of them, or to kill enough and then let your immune system take care of the rest. They like to hide, disguise themselves, and retreat deeper into your system anytime they feel threatened. Most Lyme treatments offer temporary relief, or remission, which means they kill a load of bacteria while the rest get pushed into hiding. When this happens, your symptoms get under control and you're able to move on with your life for a time. However, sometime after treatment stops and the bacteria feel it's safe to come out, symptoms return and can be even worse than before. Borrelia burgdorferi have been shown to be able to multiply even when in dormant or cyst form. Threatened bacteria can also flee into sequestered areas where they become much harder to reach with medications. For example, into biofilms, soft and hard tissue, bones, and brain. That means starting all over again at a greater disadvantage. And a lot of people become discouraged, exhausted, run out of money, or just accept that they will never get better. Sometimes people go into denial as well, claiming they have been cured even though they still have symptoms and continue getting worse. I personally believe that it's important to keep on treating until the disease is eradicated. Of course, not all treatments are safe or affordable enough to do on an ongoing basis, so it's important to choose wisely. I think it's also important to note that even if science someday comes up with a way to kill all the Lyme bacteria in a person's body at once, we may still have to choose a slower method, because the Herxheimer or toxicity from the die-off would be too much to safely handle. When I first decided to start Lyme disease treatments, I read that it would take about 2 years. I've been treating for 12 years now, and I'm still not completely better. I don't say this to discourage you, although I'm glad that I didn't know it would take this long when I started. I say it to challenge you not to give up, no matter how long it takes. I'm continuing to improve the longer I treat. I've gone from spending half or a third of my time in bed to having an almost normal life. Although I don't plan to stop treatment until I'm completely better, in the meantime, I'm so grateful for the vastly improved and improving quality of life I'm able to enjoy as I move forward. And I should mention that I had been sick for a long time before I started treatment. My guess is 20 to 25 years, so the disease had a long time to settle in deeply before I started to fight it. If you've been sick for less time, you already have a head start on me. But whether you're very sick or have a shorter race to run, I want to encourage you to be strong and keep on fighting until it's over.